My name is Dr. Heather Towery, and I'm a physician case manager with Advanced Medical. I was trained in internal medicine, pediatrics, and nephrology. And I recently worked with a 60-year-old man who was unfortunately diagnosed with recurrence of his lung cancer. He initially was diagnosed 8 years ago with tumors in his lung incidentally when he was having abdominal pain. He had resection of that, chemotherapy and radiation, and has been having recurrent scans to make sure the tumors have not come back. Recently he was found to have several more nodules in his lung, was started on one chemotherapy regimen, and he and his family were just concerned that there may be something else better out there that he should be undertaking. We were able to gather his medical data, including his imaging, and present it to the chief of oncology at UCSF, who's an expert in lung cancer specifically. And what he was able to say is patient has had absolutely appropriate chemotherapy and radiation up until this point, but there are some other treatment options depending upon the specific tissue type of his tumor, and additional workup for those tissue-specific markers would be helpful in this case. Patient felt like with this information he was able to have a better conversation with his oncologist about treatment choices, including different chemotherapy regimens, additional radiation, and even a procedure called CyberKnife that had not been in his realm of possible prior to the expert opinion. He and his wife were just overjoyed and felt that there was still hope for him to having a cure for his cancer that had not been present prior to going through the expert medical opinion. He's told me multiple times that he's told his colleagues about the program. I want to encourage anyone who has a question about anything to do with their condition to seek expert medical opinion for additional information.